Over 60? 7 silent symptoms you should never ignore. One of them is often dismissed as just getting older, and yet it's a flashing red light for a serious disease. If you or someone you love has ever felt a little off but couldn't put your finger on it, this episode is for you. We're going to decode the subtle signals your body sends before big problems arrive. Signals that are easy to miss because they don't always look like textbook emergencies. Stay with me, because the quick self-check near the end can change how you notice your health every single day. And I'll give you a simple food-first plan you can start tonight. I'm your health scientist and food-first educator. This video is educational and not medical advice, and it's not a substitute for professional care. If you notice sudden chest pressure, trouble breathing, new confusion, weakness on one side, vision loss, or black tarry stools with dizziness, call 911 immediately. For everything else, your clinician is your partner. Bring them what you learn here so you can act early, before small problems become big ones. Here's the roadmap. First, why silent symptoms matter more after 60. Then 7 warning signs most folks overlook, the conditions they can signal, and what to do next. When to call 911, when to schedule a visit, and what food-first habits support the medical plan your clinician chooses. We'll end with a 60-second daily self-check and a clean, simple plate template that steadies blood pressure, blood sugar, and inflammation, because food is one of the few levers you can pull multiple times a day. Why do subtle signs get missed in older adults? 3 reasons. First, aging can mute classic symptoms. A heart attack may feel like indigestion, jaw tightness, or unusual fatigue instead of crushing chest pain. Second, medications can mask warning signals. Pain relievers, acid reducers, blood pressure pills, and sedatives all change how the body talks. Third, we normalize changes. I'm just slowing down. Must be the weather. I didn't sleep well. And the moment passes. The goal here is not fear, but pattern recognition. When you know the pattern, you can act quickly and calmly. Silent symptom 1, chest area discomfort that doesn't feel like classic chest pain. This can show up as a pressure in the upper back, tightness in the jaw or arm, a band around the chest, a wave of nausea, a cold sweat, or a sudden profound fatigue that makes you want to sit down right now. It might be reflux. It might be nothing. But it can also signal reduced blood flow to the heart, especially in women and people with diabetes. If this is new, severe, or paired with shortness of breath or sweating, call 911. If it's mild and recurring, schedule a prompt visit. Food-first support over the long haul includes a Mediterranean-style pattern. Abundant vegetables, beans, whole grains, nuts, olive oil, fish twice a week, and fewer ultra-processed foods. Keep evening meals lighter and give yourself a 2 to 3 hour buffer before bed to reduce reflux confusion. Silent symptom 2. Brief confusion, word-finding trouble, drooping on one side of the face, clumsy hand, or a leg that doesn't quite cooperate, and then it clears. Many people shrug this off, especially if it resolves in minutes. That can be a transient ischemic attack, or TIA, a serious stroke warning. Think of it as the smoke alarm chirping before the fire. This is a 911 situation even if you feel fine now, because risk is highest right after a TIA. Over the long term, food supports a blood pressure-friendly lifestyle. Fruits, vegetables, legumes, nuts, low-fat dairy, herbs and spices instead of salt, and smart hydration. But urgent evaluation comes first. Your clinician may look for atrial fibrillation, carotid artery narrowing, or clotting risks and decide on medications or procedures that save brain cells. Silent symptom 3. Unintentional weight loss, about 5% of body weight over 6 to 12 months without trying. If you're 180 pounds, that's 9 pounds. If you're 140, that's 7. I'm finally losing the belly can feel like good news, but when the body loses weight uninvited, it can be a sign of cancer, overactive thyroid, COPD, advanced heart failure, depression, malabsorption, poorly controlled diabetes, or medication side effects. Track weight once a week, first thing in the morning, same scale, same amount of clothing. If the trend continues or comes with night sweats, fever, or a new cough, book a visit. Food-first support, once you and your clinician know the cause, often means protein at each meal, roughly 1 to 1.2 grams per kilogram body weight daily if appropriate for your kidneys. Think eggs, Greek yogurt, beans, tofu, fish, or poultry. Add calorie-dense whole foods like olive oil, avocado, nuts, and whole-fat yogurt if your care team approves. Frequent small meals can be friendlier than large plates when appetite is low. Silent symptom number 4, persistent night sweats or unexplained fevers. Menopause hot flashes are common, but drenching ongoing night sweats or fevers without an obvious infection deserve attention. Causes range from dental infections and urinary tract infections to thyroid disease, tuberculosis, medication effects, and certain blood cancers like lymphoma. Start a 3-column log: time, temperature, and how you felt that day. If fevers or night sweats persist beyond a week or two, or you also notice weight loss, cough, or swollen nodes, see your clinician. Food First Support emphasizes an anti-inflammatory plate: leafy greens, deeply colored fruits and vegetables, legumes, whole grains, herbs, spices, and careful alcohol review. Alcohol can worsen night sweats and disrupt sleep architecture. Silent symptom 5, being just winded. Walking to the mailbox, needing 2 or 3 pillows to breathe comfortably at night, or noticing your shoes fit tight by evening. This one gets waved away as aging or deconditioning, but it can signal heart failure, anemia, COPD, or even a blood clot in the lungs. New sudden shortness of breath at rest, chest pain, or pink frothy sputum, call 911. If it's gradually worsening, book a visit promptly. Track morning weight and ankle swelling. A 2 to 3 pound jump overnight can be fluid. Food First Support often includes sodium awareness. Many people get more salt from bread, deli meats, canned soups, and condiments than from a salt shaker. If your kidneys and medications allow, potassium-rich foods like leafy greens, beans, and citrus can help balance sodium. But only under your care team's guidance, especially if you take ACE inhibitors, ARBs, or spironolactone. If blood tests show iron deficiency anemia, pair iron-rich foods, beans, lentils, leafy greens, lean meats, with vitamin C sources like bell peppers or berries to boost absorption. Silent symptom 6, a new severe headache after age 50, scalp tenderness when brushing your hair, jaw pain when chewing, or vision that goes dim in one eye and then returns. These can be clues to giant cell arteritis, an inflammation of blood vessels that needs same-day evaluation to protect eyesight. Other possibilities include a glaucoma flare, a subdural bleed after a minor head bump, or a hypertensive crisis. If the headache is thunderclap, sudden and the worst of your life, call 911. If you have new temporal tenderness or jaw claudication, seek urgent care today. Food can't treat these acute conditions, but long-term blood pressure steadiness truly matters. Regular meals rich in potassium and magnesium when appropriate, less sodium, daily movement, and careful caffeine and alcohol patterns. Both can spike pressure. Silent symptom: bathroom changes you ignore, painless blood in stool or urine, black stools, or new nocturia with unquenchable thirst. Bright red stool can come from hemorrhoids, but it also points to polyps or colorectal cancer. Black tarry stools can mean bleeding higher in the GI tract. Blood in the urine may be a UTI or kidney stone, but bladder or kidney cancers need to be ruled out. Waking multiple times to urinate and feeling unusually thirsty can be a diabetes clue. In men, frequent nighttime urination can also reflect prostate enlargement. Any visible blood or tarry stools warrants prompt medical attention. Heavy bleeding, dizziness, or weakness is ER level. Food First Support emphasizes fiber for regularity: beans, oats, berries, chia, adequate hydration, and a conservative stance on alcohol and processed meats, which correlate with colorectal risk over time. Let's pull this together into a practical model you can start today. Your 60-second self-check happens at the same time each day, ideally morning. Blood pressure, if you have a home monitor. Save the reading in your phone. Body weight once a week. Look for trends, not daily noise. Ankles and shoes? Any new swelling? Breathing. Can you walk to the mailbox or up a flight of stairs without stopping? Brain? Any brief confusion? Word slip? Face droop? One-sided weakness? Bathroom? Any blood? Black stools? New thirst? Or nighttime trips? Pain and fatigue? Any new patterns that are different from your normal? Medications. Take them as prescribed. Keep a list. Review interactions annually. Now the plate that quietly supports everything. Half your plate non-starchy vegetables. A quarter protein. Fish, poultry, tofu, tempeh, beans, or eggs. A quarter high-fiber carbohydrates. Beans, lentils, quinoa, oats, or sweet potato. Plus a thumb-sized serving of healthy fat like olive oil, nuts, or avocado. Aim for fish twice a week, especially salmon, trout, or sardines for omega-3s. Season with lemon, herbs, garlic, and spices to lean less on salt. Hydration matters. Sip water evenly during the day. If nighttime urination is a problem, shift most fluids earlier and taper after dinner unless your clinician advises differently. Clear rules for action keep you calm when something changes. Call 911 immediately for sudden stroke-like symptoms. New pressure-like chest discomfort with shortness of breath, nausea, or sweating. Severe shortness of breath at rest. Sudden severe headache. New vision loss. Or black. Tarry stools with dizziness. Book a same-day or next-day appointment for new exertional breathlessness. Orthopnea. Ankle swelling. Unintentional weight loss. Persistent night sweats or fevers. New headaches after 50. Any visible blood in stool or urine. Or new excessive thirst and urination. When in doubt, err on the side of urgent evaluation. Clinicians want to catch things early. What tests might your clinician discuss? Personalized to you. Think of these as tools in the toolbox, not a to-do list you order yourself. For heart and brain risk, a blood pressure log, fasting lipids, and possibly an EKG or heart rhythm monitoring if palpitations or TIAs are suspected. For metabolic health, fasting glucose or A1C. For fatigue or breathlessness, a complete blood count and iron studies can uncover anemia. Thyroid-stimulating hormone for unexpected weight loss or heat intolerance. A basic metabolic panel for kidney function and electrolytes. For suspected heart failure, BNP and an echocardiogram may be appropriate. For bathroom changes, a stool fit or colonoscopy on the recommended schedule, and a urinalysis or imaging if blood in the urine appears. For new temple pain and vision changes in older adults, inflammatory markers like ESR and CRP with urgent ophthalmology input, your clinician will guide which of these apply to you based on your history, medications, and exam. Let's make this actionable with 3 daily moves. First, track something small every day. Blood pressure, steps, or a symptom note. Awareness turns patterns into decisions. Second, build the SMART plate at least once a day. If dinner is hectic, make lunch your anchor. A large salad with beans and a can of wild salmon, olive oil, lemon, and whole grain crackers checks every box. Third, move your body in ways that are kind to your joints but fierce for your heart and brain. A brisk 10-minute walk after 2 meals, light resistance work for legs and back, and balance practice while brushing your teeth. None of this replaces medical care. It strengthens it. Before we wrap, a gentle reminder. The goal isn't to chase every twinge, it's to notice meaningful change. The body whispers before it shouts. New chest pressure, stroke-like symptoms, sudden breathlessness, or black stools. Those are shouts. For the whispers, night sweats that linger, weight drifting down without trying, getting winded on small hills. New headaches after 50, bathroom changes. Pay attention and bring them to your clinician. Early is easier. If this helped, drop the word checklist in the comments and I'll share a printable daily self-check and the plate template we talked about. Subscribe if you want the upcoming Symptom Decoder episodes. Next time we'll unpack the most confusing topic of all. When heartburn isn't heartburn. Meanwhile, be kind to yourself, feed your body on purpose, and remember, small steady changes plus early attention to warning signs. That's how you protect your future health.